Welcome to ENT student. Today we are going to discuss the examination of thyroid glands. These are the anatomic relations of the thyroid. Laterally to the thyroid gland there are two carotid arteries and below it there is cricoid cartilage. History. Physiological goiter occurs in puberty and Hashimoto's disease occur in women who have just passed the menopause. Goiter is not associated with pain actually, and if there is any pain it indicates the hemorrhage inside the goiter. We should also inquire about the pressure effects of the goiter in the history, such as if there is pressure on trachea it causes dyspnea, and if there is pressure on esophagus it causes dysphagia. Pressure on recurrent nerve causing hoarseness of voice. Coming to the general examination of the thyroid gland, we should look for excitability, trembling, nervousness, sweating, wasting, etc. And coming to the local examination of the thyroid gland, firstly, inspection. Position of the thyroid. The two lobes of the thyroid is connected by the isthmus which overlies over the second and third tracheal rings. The size of the glands. Goiter is considered if the lateral lobes have a volume in excess of the terminal phalanx of the thumb of the patient. Shape. The gland is usually symmetrical in primary hyperthyroidism, while it is irregular in secondary or nodular toxic goiter. We should also inspect the overlying skin. The color changes in goiter is unusual unless it is very large. The distended veins may be responsible for dusky blue appearance. Surface pulsations are to be inspected. Mobility. Ask patient to swallow. Thyroid swelling moves upward on swallowing. Thyroglossal fistula. It is seen below the hyoid bone in the midline. Thyroglossal cyst. As thyroglossal duct extends from foramen cecum of the tongue to the isthmus of the thyroid, it moves upward on protrusion of the tongue. Palpation. The thyroid should be palpated from the front and from behind the patient with the neck slightly flexed. The patient is asked to swallow during the palpation. Any enlargement of the thyroid gland or any nodule is palpated by placing the thumb on the thyroid gland during swallowing. Palpation of the thyroid gland is done by Lehes method, in which the examiner stands in front of the patient and in order to palpate the left lobe, the thyroid is pushed from the right side making the lobe prominent and the palpation is done by the other hand. Consistency. A solid cystic swelling is under great tension and imparts a solid feeling, while cellular swelling having no tension and feels soft. Pain and tenderness may occur in thyroiditis. Mobility. Fixity is present in carcinoma and thyroiditis. Relationship. Observe its relationship with neighboring structures. Involvement of neighboring structures. If there is involvement of the sympathetic trunk, it gives rise to Horner's syndrome. If there is involvement of the recurrent laryngeal nerve in the swelling, in malignant growth, it produces hoarseness of voice. And if there is involvement of the esophagus, it produces dysphagia. Position of the larynx and trachea. Observe whether larynx and trachea is displaced by swelling or not. Coming to auscultation. In primary toxic goiter, as a systolic bruit may be heard due to increased vascularity called thyroid thrill Gutman sign. Measurement of circumference of the neck at the most prominent part is taken to know if swelling is increasing or decreasing in size. Primary toxic goiter. The four cardinal features of primary toxic goiter: exophthalmos or protrusion of eyeball, enlargement of thyroid gland, tachycardia, tremor. Certain signs are attached with exophthalmos are Van Griffith's sign, lagging behind the upper eyelids when patient look downwards. Stellwag sign, retraction of upper eyelids. Dalrymple signs, widening of palpebral fissure. Geoffroy sign, absence of wrinkling of forehead and looking upwards with face inclined downwards. Mobius sign, difficulty in convergence of eye. Thyroid storm, it is exaggerated stage of hyperthyroidism. It is life-threatening. The precipitating factor is thyroid surgery in patient of hyperthyroidism not well prepared before the surgery. Thank you.